Now I'm going to talk about the dialysis machine, which is a life support equipment. Dialysis is the method of removing excess solutes or toxins from the blood. It is used on people whose kidneys have been damaged and are incapable of performing these functions. It is a type of renal replacement therapy. Dialysis machines are essential for those who have kidney damage or lost kidney function. The technical features: microprocessor controlled device capable of providing hemodialysis, hemofiltration, and ultrafiltration therapies. A blood tubing set designed for the dialysis machine, a dialyzer, a heparin filled syringe, and appropriate dialysate concentrates. Plant preventive maintenance: clean filters and replace O-rings if damaged or corroded. Inspect the power plug for loose or frayed wires. Inspect the entire length of the power cord. Connect an external conductivity meter to the dialysate lines. The problems faced: firstly, poor needle replacement, inadequate needle gauge, dislodgement. Secondly, mismatch with membrane characteristics. Third, incorrect dialyzer or blood tubing. Fourth, the machine is alarming. Troubleshooting: as for the circuit, start from the machine and work along the circuit, checking for kinks. Check the wastegate for kinks. Ensure it has not become dislodged. Obviously, unlink the kinked beads. Try to gently rotate the vase cut if possible. Some positions may be better than others. Pause dialysis and aspire the vase cut lumens, trying to suck out the cloth. As for the patient, an agitated patient who is constantly repositioning themselves will play havoc with the excess pressure. Encourage their cooperation. Ensure there is enough venous blood. Ensure the respiratory pattern is not. The next is sterilizers, a treatment equipment. Hospital sterilizers kill all forms of microbial life including fungi, bacteria, viruses, spores, and all other entities present on surgical tools and other medical items. An autoclave sterilizes equipment and supplies using high pressure saturated steam for a short period of time. The technical features are vessel, control system, thermostatic trap, and safety valve. Plant preventive maintenance: there is a table which shows the maintenance task. Problems: first, the sterilizer won't reach the temperature set point. Second, the load is damaged by the autoclave. Third, goods are not sterilized. Fourth, the load is wet after the sterilization cycle has ended, even with drying time. Fifth, a large liquid load causes the sterilization cycle to abort. Sixth, excessive amount of water are going down the drain. Troubleshooting: the table shows the problems faced and the corrective actions should be taken. Followed by ECG machine, a diagnostic equipment. Electrocardiogram machines record the electrical activity of the heart over a period of time and allow healthcare providers to monitor the overall rhythm of the heart and identify any abnormalities. Technical features: features built-in pacemaker detection to ensure that patient pacemakers are working as intended. Has a high resolution 7-inch touch screen for instant analysis. Includes a built-in troubleshooting function to help make using the QRS-12. Plant preventive maintenance: after completing daily ECG tracing, the electrode should be kept clean. Electroless copper alloy silver-plated electrode is washed with water to dry. Avoid bruising silver coating. Lead wire or shielded cable break or damaged easily. especially near the ends of the joints. Avoid pulling or twisting force. The connection should be set into larger diameter ring or hang. Avoid excessive distortion or sharp folds. AC and DC ECG machine should explain timely charge to extend battery life. ECG should avoid heat, sunlight, moisture, dust or shock with complete cover dust cover. Open the cover every 6 months to remove dust, dehumidification and checked. Problems faced: no current, millivoltage scaling voltage, battery voltage indicator does not light. Several common interference came out when using ECG machine. Troubleshooting: first, eliminate the stylus wick is not strong. The coil spring, sealing off and sensitivity potentiometer adjustment initiative and easy to find inappropriate. Secondly, to check whether the normal IMV calibration switch off. Check the standard battery without electricity or electrical fault cannot produce IMV standard voltage. Then check if the amplifier is no normal power supply or an optocoupler component is faulty. First, the battery from the left side of the machine removed. When checking the battery voltage is normal, the battery charging circuit is no problem. ECG interference often malfunctions in use, even affect the normal ECG tracing. You can use the calibration switch on the machine panel judge. The specific measures are: first, lead selector switch set calibration position. The paper feed switch to the recording position. A pen to see if there is interference. If you take the paper record is a straight line and then presses the calibration switch, such as scaling wave interference indicating ECG machine itself in malfunctions. If there is no interference indicating ECG machine itself is no problem. Interference by external factors including machine, lead wires, electrodes or the surrounding environment disturbance.
Electrosurgical unit. Laboratory type in hospital is tremor equipment. Use a high-frequency electrical current to cut tissue and control bleeding by causing coagulation. Tissue resistant to the high-density current cause a heating effect which results in tissue degradation. The current is delivered and received through cable and electrode. Feature: pure cut and blank cut function, contact coagulation and bipolar coagulation, display output power digitally, allow operator to check output power easily using procedure. Preventive maintenance (PPM). Verify the physical integrity and clear line of the KC. Verify physical integrity of equipment mouse, fastener, cluster, and breakers as applicable. Verify the integrity of the AC plug. Be sure to inspect all cable and connector. Verify proper insulator and integrity of the line plug. Verify physical integrity at both ends of line cord of the stand relief. Verify integrity of all external circuit, breaker, and value of external fuse. Check for any leakage for KC or electrode to provide the possibility of operator shock. Troubleshooting. Check the ESU for physical damage. Verify all accessory cords are connected properly. Check the condition of the power cord. It should not be fade, damaged, shed, or exposed. Of any wire of the waste, replace the same immediately. Check the fuse of ESU. It should be fully fit inside the fuse socket. Also, Check for any corrosion and damage is so replace the same rating of fuse as mentioned in the manual and on each SU. Disconnect the power cord and check the full switch replacement damage of obstruction. If found, replace the rear pan of rear pan connection. Check for the free contents of bipolar or monopolar instrument receptacles on front plane for obstruction and damage. If found, replace the front plane or front plane connection. Patient return electrode receptacle for any broken pin and obstruction. If found, replace the front plane or front plane connection. Anesthesia machine. The laboratory type is life support equipment. Anesthesia machines are designed to provide an accurate and continuous supply for medical gas to maintain a proper level of anesthesia to a patient. Modern anesthesia machines include tools such as ventilation, suction unit, and patient monitoring device. Technical feature: auto and pediatric assistant polyclinic procedure neutrals. Monitor with 5 multi-power facility. Improved ISO fluorine, sulfur fluorine, halogen vaporizer. Nanometer circle absorber system. Extra space with dual drawer. Soundless ball channel system. Bedside operator for gas input system with UCAS and SSB. Now we talk about the PPM of anesthesia machines. Electrical safety inspection and battery replacement for different vaporizers. Second, physical inspection for loose or missing screw, spare of loose connection. Next, visual inspection for mechanical or electrical damage. 4. Verify operator of safety interlock if applicable. Verify operator of handwheel loose and release button. Verify handwheel turn smoothly without in linear range. Check fuel drain system operate properly and that there are not leaks. Proven and troubleshooting. Inspection are not stating anesthesia even with the vaporizer set to 4% or higher. We can using the step below to solve the problem. First, check for the right bronchus intubation. Second, check the bending circle and endotracheal tube for physical alteration. If found, remove. Check the system for any leaks. Check the engineering system as there may be more than one leak. Next, check the evacuation system for the appropriate balance of positive and negative pressure. Lastly, check the oxygen flow meter and regulator. Now we talk about the defibrillator equipment. The type of laboratory is life support equipment. Defibrillation, also called the AED. AED is a portable electronic device that automatically diagnoses the life-threatening cardiac arrhythmias of ventricular fibrillation and ventricular tachycardia, and is able to detect through defibrillation. The application of electricity which stop the arrhythmia, allowing the heart to be stable and effective rhythm. Feature. First one, compression alarm system. Lightweight and portable. Integrated thermal recorder. Next, defibrillation with synchronized cardiac vision. Moreover, AED with defensive technology and the voltage 100 volts to 214 watts and 50 per 60 Hz. Now it's about the ppm. We need to inspection of refill ready kit. Then, evaluation of signature as requested by law. Replacement of AED supply when needed, based on the expiration date or manufacturer recall. Complete report with inspection recommendation sent to AED coordinator and affected by manufacturer recall. The troubleshooting of this equipment. Attack the external and internal pedals if the monitor read not pedals. Check the ensure that the leads are securely attached if the monitor read not leaked. Connect the unit to AC power if the message read low battery. Verify that the energy select control settings are correct if the defibrillation does not charge.
In this video, I will describe three equipment, and the first one is CT scan. This is diagram of CT scan. CT scan is a computerized tomography scan combines a series of X-ray images taken from different angles around your body and use computer processing to create cross-sectional image slice of the bones, blood vessels, and soft tissues inside your body. CT scan image provide more detailed information than plain X-ray do. So, CT scan can be used to diagnose conditions including damage to bones, injuries to internal organs, problems with blood flows, stroke, and cancer. The aperture should be at least 65 cm diameter. The CT scanner should have low wattage slip rings incorporated in the gantry. The scan time for a 660-degree rotation should be less than a second. The gantry should have a minimum tilt of 30 degrees on either side, and removed tiles should be arrival as standard. The preventive maintenance routine for your CT scanner should include an annual investigation to prevent any possible defect and to identify signs of wear. It's encouraged to also perform monthly checks for your calibration, radiation dosage, and image resolution and accuracy. First, equipment must not be affected by magnetism, so non-magnetic screws should be used. Second, everything must be kept clean, so highly corrosion resistant parts should be used. And the third one is, equipment must not be affected by microwave, so plastic screw with excellent insulating properties should be used. CT scan is a diagnostic equipment that used in the private hospital and government hospital, and it has their own room for the CT scan, so mostly patients need to make an appointment to do their checkup while they need to using the CT scan. A seismomanometer, also known as blood pressure monitor or blood pressure gauge, is a device used to measure blood pressure, composed of an inflatable pump to collapse and then release the artery under the cuff in a controlled manner, and a mercury or anaerobic manometer to measure the pressure. It is composed of an inflatable rubber cuff which is wrapped around the arm. A measuring device indicated the cuff pressure. Above inflate the cuff and a valve release pressure. You must take care if you have to maintain them. Do not handle mercury. Do not breathe in the fume or the black powder that may be found in the tube or reservoir. Over a period, mercury and its oxide are toxic. Maintenance of this should be done once a year. Seismomanometer usually cannot work because it's likely that the air valve on cuff is jammed. There are two issues that may contribute to this problem. Either the valve has become clogged with dust or debris, or an internal component called the slip stopper has become bound from an extended lack of use. So, to overcome this problem, must always clean the air valve, make sure it's clean and did not jam. Seismomanometer is a type of durable medical equipment that you can see used in clinical and also hospital. And the seismomanometer is not a very big equipment. Usually you can see on the table on doctor, so the doctor can use it very easy and directly to the patient when the patient need to measure their blood pressure. Suction machines are appliances that are used to remove substances such as blood, saliva, mucus, and vomit from a person's airway. A portable suction unit can prevent pulmonary aspiration and facilitate breathing. Suction machine supplies include bacteria filter, collection canisters, and aspirator tubing kit. The suction machine should be capable of producing minimum vacuum of 500 approx mmHg, which should be adjustable and monitored by vacuum gauges of suitable range. The suction capacity should be 15 liters per minute and can be regulated. First, the need for power. A suction unit can't run on dead batteries. It's up to you to ensure the batteries are fresh at the start of each shift or after each use. The main benefit of a portable suction unit is its portability, but that portability means it must rely on its own power source. So make sure that power source is up to the task and replace all battery as needed. The second, maintenance is key. To maximize the benefit of your suction unit, you must maintain it. This means not only ensuring it has power, but that it is clean and well stocked, because secretion of any type pose serious infections risks. The unit must be thoroughly decontaminated after each use. That means following the manufacturer's guideline for cleansing and ensuring all disposable parts are replaced. Be sure the unit is fully stocked at all times. Extra catheters in an array of sizes are essential for meeting the need of each respiratory emergency. So be sure you replace as needed and use the right size for the job. A small tip will not meet the demands of clotted blood or vomit. So have larger catheters on hand for this situation. Third, suction with care. Not every airway is the same, so be careful when applying suction, especially in the case of elderly patients or the very young. Geriatrics typically will have fragile tissue and extensive dental hardware, so suction with care and precision. The same can be said of pediatrics. Their smaller mouth and nose require the same care and precision you apply to geriatrics. So use a smaller catheter and suction unit that has variable pressure control. First, machine is not plugged in or is not turned on. So, plug machine into a working 3-hole outlet, press on or off, switch to turn machine on. Second, suction pressure is not properly set. Make sure suction pressure is set as instructed by your PHS clinician. So firstly, turn machine on, block end of suction tubing, read outer numbers on pressure gauges, use control knob to adjust to desired safe suction pressure. Third, low or no pressure at regulator port. So you must turn machine on, use finger to complete cover regulator port, check suction pressure by reading outer numbers on the pressure gauge, turn control knob to adjust pressure to desired safe suction pressure level. If low or no suction pressure, call PHS. If pressure is as desired, safe suction pressure, continue to next step. The fourth problem, low or no pressure at end of filter. You must connect one end of the 3-inch Tigon tubing to the regulator port and the other end to one side of the filter. Turn machine on and feel for suction on the side of the filter without the Tigon tubing. If there is low or no suction, replace filter with a new one and recheck suction pressure. If pressure is at desired self-suction pressure, continue to next step. The fifth problem, low or no pressure at patient port. So, you must connect one end of the 10-inch Tigon tubing to the free end of the filter, connect the other end to the elbow adapter on the vacuum port of the canister lid, turn machine on, feel the suction at the patient port on canister lid. If there is low or no suction, you must dump content of canister. If full into toilet, tap the overfill float on canister lid to make sure it moves up and down. Second, make sure there are no cracks in the canister. Throw out cracked canister and replace with new one. Third, make sure the canister lid is firmly attached. If pressure is at desired self-suction pressure, continue to next step. Lastly, low or no pressure at end of suction tubing. You must connect suction tubing to patient port on canister lid, turn machine on and feel for suction at open end of the suction tubing. If low or no suction, throw out suction tubing and replace with new suction tubing. Recheck suction pressure. This suction unit is a type of treatment equipment normally used in private or government hospital. The device can move anywhere, so it's convenient to move to a patient or bed.
X-ray machine. Function of X-ray machine. X-ray are high penetrating ionizing radiation. Therefore, X-ray machines are used to take picture of dense tissue such as bones and teeth. This is because bones absorb the radiation more than the less dense of tissue. X-ray from a source pass through the body and onto a photographic cassette. It is also to scan broken bone and also used in radiation therapy. The types of the laboratory where the equipment is attached: radiography room, radiologist hospital, and hospital registered under government. Technical feature of the equipment. The advantages offered are to help the doctor in making a right analysis, accordingly detailing a treatment territory, and this will exceed any little danger incurred. On the off chance that the therapy plan is exclusively found on clinical discoveries, at that point introduction to radiation, even with insignificant danger, may significantly affect your well-being. Plan preventive maintenance. First, perform regular inspection based on a set schedule. Second, see manual usage book for operating the machine. Troubleshooting for X-ray machine. First, normal aging. X-ray tubes age and have a limited life because the characteristic and material used begin a gradual degradation and are consumed, so that performance gradually decreases until they no longer perform satisfactorily. Second, application mismatch. Early mammography is a good example of tube mismatch when the standard diagnostic tube was used to produce mammogram. The resulting diagnosis was rather poor and radiation burns often the result. Lastly, improper drive by the power supply. In an X-ray source, the power supply provides all the necessary power to operate the tube, including the filament and often the rotor supply for a rotating anode tube. Ultrasound machine. Function of ultrasound machine. An ultrasound machine makes image so that organ inside the body can be examined. The machine sends out high-frequency sound wave which reflect of body structure. A computer receives the wave and uses them to create a picture. Unlike with an X-ray or CT scan, this test doesn't use ionizing radiation. The laboratory where the equipment is attached: radiology specialist, radiograph room, medical specialist, and maternity clinic. Technical feature of the equipments. First, they are generally painless and don't require needles, shots or cut. Second, ultrasound capture image of soft tissue that don't show up well on X-rays. Lastly, ultrasound are widely accessible and less expensive than other methods. Plan preventive maintenance. First, check the ultrasound machine daily. Second, listen to your ultrasound transducer. Lastly, schedule regular service for your ultrasounds. Troubleshooting. First, tone strength relief. Second, cable sheet damage. Third, lens failure. Lastly, lines in the image area. Ventilator machine. Function of ventilator machine. Ventilators are machines that blow air or air with extra oxygen into your airways and your lungs. Your airways are pipes that carry oxygen-rich air to your lungs when you're breathing. Where the equipment is attached. First, cardiac care unit. Second, respiratory unit. Third, intensive care unit. Lastly, specialist respiratory hospital. Technical features of the equipment. Plan preventive maintenance. First, change the air intake filter. Second, verify that all audible and visual alarms are working properly. Third, run a full performance check where you will check all modes of operation of the ventilator. Lastly, some ventilator manufacturers allow for some parts to be chemically cleaned or treated. Troubleshooting for ventilator machine. First, check ventilator setting and function and check circuit for obstruction or kinking. Second, for patient or ETT problems, examine the patient looking particular for wheeze, asymmetrically chest expansion and evidence of collapse. Lastly, pass a suction catcher through the ETT to check its patency.